Hey everybody, welcome back. Bob Finelli, kinesiologist, exercise physiologist, fellow of applied functional science. So today in our functional training series, we're going to talk about the biomechanics of throwing from the ground up. So remember, in functional training, we want to mimic the movements, not the muscles. So we have to know what those movements are to then be able to create a program to get there. What prompted this? I'm a huge baseball fan and there's a ton of elbow injuries, and sometimes when the elbow gets hurt, it's because the rest of the system didn't load well. So let's talk about what we have to do to load from the ground up, okay? So if I'm a righty pitcher, be a lefty, but we'll use righty because I am. I'm gonna need dorsiflexion at the ankle, okay? I'm gonna need subtalar joint eversion. I'm gonna need my mid-tarsal joint to unlock. In other words, my foot's gonna have to become mobile and adaptable. At the knee, I'm gonna need flexion, abduction, and internal rotation. And at the hip, I'm gonna need flexion, adduction, and internal rotation. Those movements are critical so that I can load and then explode. If I'm missing one of them, let's say for example, I don't have that good motion at the foot, then I may not get the good motion at the knee, the hip, because we know in function it's a chain reaction. So what may happen is I may open up early, we call it open up early, and all of a sudden my elbow is going to do a little more. So a functional training program for that would go after those motions for that pitcher to try and help and protect their elbow.